My name is Olusumbo Ogunleye, and I'm taking research and evidence-based practice this semester, and I'm going to be talking about the COVID-19 pandemic in my signature assignment. I will be talking about how COVID-19 came into existence, the data all over the world, the data in the United States, and I live in Arizona, the data in Arizona also. Then I'll be talking about the ethical considerations, what I'm going to do as a nursing student or as a nurse to help solve this problem. Okay, so the history of COVID-19. The novel human coronavirus disease is the 5th documented pandemic since the 1918 flu pandemic, and it was first reported in Wuhan, China, and it spread all over the world within the last 8 months. So the International Committee on Taxonomy of Viruses talked about how COVID-19 is now described as the SARS-CoV-2, and it is believed to be a spillover of an animal coronavirus, which was adapted by the ability of human-to-human transmission. That means if a human being coughs or is close to a COVID-19 patient that has symptoms, there is a high possibility that the person can get infected with the virus. Okay, so there are so many factors that can cause COVID-19, and it is critical for studies of pathogenicity and antiviral designs and vaccine development against the virus. Currently, people all over the world have been affected by coronavirus 2019, and since it was discovered in Wuhan city in China in late December 2019, so many people have had the symptoms. Some of the symptoms of a patient with COVID-19 are fever, malaise, dry cough, dyspnea, and sometimes they are diagnosed with viral pneumonia. Before the virus was called COVID-19, it was called the Wuhan virus by the press, and it was discovered that the whole genome sequencing results show that the causative agent is a novel coronavirus. The novel coronavirus is the 7th member of the coronavirus family to infect humans. The World Health Organization temporarily termed the new virus 2019 novel coronavirus on January 12, 2020, and then officially named this infectious disease coronavirus disease 2019 on February 12, 2020. The International Committee on Taxonomy of Viruses, ICTV, officially designated the virus as SARS-CoV-2 based on the phylogeny, taxonomy, and the practice of the virus. And the human-to-human transmission of COVID-19 occurring within Hong Kong has been shown in clinical data. So many researches have been carried on by the World Health Organization, the Center for Disease Control and Prevention, private organizations, and public health organizations to describe how the virus is spread and how people can prevent it from spreading. So now I'm going to talk about the statistics of coronavirus, because the Center for Disease Control and Prevention is working closely with the World Health Organization and other partners to assist countries prepare for and respond to COVID-19. The Center for Disease Control and Prevention provides technical assistance to ministries of health and subnational and international partners to improve our collective responses to infectious disease. So, as at July 17, 2020, the data for the coronavirus in China shows that 83,622 people have been confirmed to have the virus, and 78,737 people recovered from coronavirus in China. However, the number of deaths is like 4,634 in China. Globally, about 13,837,395 people have been confirmed to have coronavirus all over the world. The number of deaths is at 590,650. The number of people that have recovered all over the world, I can hold it.
Okay.
So that you can go. You can go. The number of people that have recovered from the virus all over the world is 7,738,819 people. In the United States of America, we have 3,533,905 confirmed cases of coronavirus. And we have 138,358 as the total number of deaths for coronavirus. So I'm going to talk about how the Spanish flu of 1918 evolved and how we discovered the COVID-19, which is also known as the SARS-CoV-2. In 1918, the Spanish flu evolved and it killed a lot of people because there was no vaccine to combat the disease, the virus disease. In 1957, another influenza A virus was affecting people, and it was called the Asian flu. It's called H2N2. There was no vaccines, but some people survived while some people died. In 1968, in Hong Kong, another virus evolved, and it was called the Hong Kong flu, H3N2. It killed a lot of people, and they developed the vaccine to solve the problem. In 2009, a pandemic flu, which was called H1N1 influenza A virus, affected a lot of people too, and it started in China. So some people died from it, some people recovered, and there was a vaccine for the flu. The most recent influenza virus is the Covid-19, which is called coronavirus. And as at May 11, 2020, 282,719 deaths have been discovered. It is approximately 1.5 billion deaths due to the Asian flu, which evolved in 1957. The Hong Kong flu killed about 300,000 people. The first 1918 Spanish flu killed about 50 million people all over the world. I live in Arizona, so I'm going to talk about how COVID-19 has affected people in Arizona. We have about 13,613 cases of coronavirus confirmed, and there are about 2,492 deaths as of July 17, 2020. Some other states are affected by coronavirus. Florida, California, Texas, they have a lot of confirmed cases and people are dying, and some people are recovering from the virus. Based on the symptoms of coronavirus, the ways to prevent it are actually, before I talk about that, I'm going to talk about the people at risk. People that are older than 65 years old have a higher risk of contacting coronavirus. The vulnerable populations like the immigrants, prisoners, homeless, they are at higher risk because it is a disease that needs people to practice safe social distancing. But if you live in the homeless, you might not be able to do that because so many people are crammed in a small space. And people with underlying medical conditions can also have coronavirus, like people with diabetes, chronic heart disease, liver failure, kidney disease, congestive heart failure, and other cardiac issues. So other people at risk are the first responders, like the firefighters that people call when there's an emergency, the emergency medical service. Also, they are at higher risk because they respond to people in an emergency situation. The ways to prevent coronavirus are to wash your hands at least for 20 seconds with soap and clean water, use face masks, practice social distancing, avoid crowded places, avoid touching your eyes, nose, and mouth. People who live in states that have a higher confirmed cases of coronavirus should self-isolate if you visit in another state at least for 14 days. It's also important to stay hydrated and rest if you have coronavirus. I'm going to talk about the theoretical model that has been used for the COVID-19. So many researches has been done since coronavirus started last year, December. The Chinese and some countries in Asia, they've done a lot of research to link the Spanish flu, Asian flu, the 2009 SARS pandemic flu, the Hong Kong flu of 1968, to see how the virus evolved and how vaccines were developed to help people. So many researchers and clinicians have worked on this, and they've found out that the best thing is to practice hand hygiene, social distancing, educate the community about preventive techniques, which are make sure you wash your hands, don't touch your nose, don't touch your mouth, stay at least 6 feet in a public place when you go to the grocery store, when you go to the parks. And like some few months ago, some states had a lockdown where people can only go out maybe for work or for essential items. So that helped to reduce the spread of coronavirus. But some states opened too early, like Florida and Arizona. So California, because the beaches were opened and people went there for the Memorial Day, and some of these people got infected with the virus. So the best thing is to practice social distancing and adhere to the government regulations concerning the COVID-19. The theoretical model used for this COVID-19 in this research work was to ensure that people with previous respiratory infections related to COVID should practice social distancing and, if possible, stay at home. to prevent the spread of the disease. The hospitals have issues with personal protective equipment like face masks, gloves, gowns. So the government should work with the manufacturers so that healthcare workers and essential workers have adequate face masks, gloves, gowns, and access to soap, clean water, and sanitizer to prevent the spread of the disease. Social distancing is key in this theoretical model because if people implement social distance in public places, there will be less spread of the disease and the people will be healthy. There will be no problems. The government of the United States should work with other countries to foster trade and development and make sure there's exchange of goods and services, especially the essential goods like face masks, gloves, gowns, that will help prevent this disease. So another question, what sources of internal evidence will you use to overcome barriers to implementation? Like I said earlier, you work with the government, both federal and state, to make sure there are essential services available for healthcare workers and other essential workers. The media should educate people about COVID-19. The radio stations should do the same. They should make sure people understand what coronavirus is, how to prevent it, that there's no available vaccine for now. They're still working on it, so they should make sure they stay at home if they have symptoms and quarantine. Another question talks about, are there ethical considerations? Yes. Since the COVID-19 started early this year, schools have been closed, businesses have closed, and people have lost their jobs. So the ethical concern can be, is closing businesses and schools gonna help more people? Yes, because if people are healthy, they can work and the economy can get improved. And the kids that are home due to the COVID-19, some have online learning, some do not, but I think it's better for them to have online education so that they don't miss too much. Although some people prefer face-to-face education, but we should ensure that people are safe. When they are safe, they are able to go to school and they are able to learn more things. However, another ethical issue is many people lost their jobs. So the government provided some stimulus checks, although some people said it was not enough, but it's still better than being exposed to this life-threatening virus. Like I said, an healthy nation is a happy nation, and when the virus is contained, people can be healthy, live better, and go back to work. Some of the research I did to get the information for this COVID-19 presentation, I got my information from peer-reviewed journal articles from the Center for Disease Control and Prevention, World Health Organization, the CNN, BBC, and private and public organizations' websites. So the best way to solve this problem is to social distance and hygiene and self-isolate if you have coronavirus. Thank you. It's a pleasure presenting to you about COVID-19, and I hope everything is going to normalize and the economy is going to come back after some time. Thank you. Bye.